Hello, we have to start epidemiology and overview as we were talking about in our previous class. This is a subject and a topic of the environmental microbiology and public health. And epidemiology is a basic component of the public health, and we have considered it cornerstone in public health. So, today we have to talk, does epidemiology assist in problem solving in health related policy making? So we have to talk, we have to generate, we have to build this argument that is epidemiology helping in for the solution of any problem related to health policy. Why we are emphasizing on this question? Because the epidemiologist, he know the background of the epidemiology, mode of transmission, mode of infection, causative agent, environmental factors supporting to the causative agent, and it is behavior of that community or society, and people's behavior and environment and vectors which are transmitting. In whole, we can say that epidemiologists have all information related to any epidemics. So he know everything about that epidemiology, about that epidemics, and he have built a concept about that disease, how we can prevent it, how we can control such type of disease. Therefore, these informations are used in health policy to resolve that issue for that community. So we have to talk on this question. Epidemiology as a problem solving discipline, integrating principles. The first integrating principle is that epidemiology is an information science, because this epidemiology have information about beginning of the disease, spreading of the disease, onset of the disease, control of the disease, drugs and things are required to control this disease. The epidemiologists have all these information. The second integrating principle is that epidemiology operates with an environment of complex system. Epidemiology operates with an environment of the complex system where social behavior, environmental factors, environmental components, host features, and vehicling or transporting agents are all are discussed and all have their significant role in this epidemiology. Therefore, it is considered a complex system. The third integrating principle is that epidemiology is not just a scientific discipline but a professional practicing area. Therefore, we are saying that epidemiology as a problem solving discipline, integrating principles, it integrates all the principles to resolve an issue related to a disease occurring or spreading in a particular population for particular time in a particular region. Epidemiology is an information science. Epidemiology is an information science, we can say. Data generated by epidemiologists is to be used for decision making. The data which has been developed from this epidemiological study, it is used for decisions to control that disease in that population and of region. Epidemiology is purposive method and knowledge are to be used for the ultimate purpose of prevention of disease, disability, and deaths. Epidemiology is purpose. Its purpose is this: method and knowledge of the epidemiology are used for the ultimate purpose of prevention of disease, disability, and deaths. Epidemiology is under public scrutiny. Informations affect decisions at the public policy level, at the level of the individual, and by the health professionals a social responsibility. Therefore, okay, epidemiology is under public scrutiny. Information of the epidemiologist affected decisions at the public policy level, at the level of the individuals, and by the health professionals a social responsibility, that how they have to change their social behavior to control that specific disease from that environment. Okay, information from epidemiology generation, information generated from epidemiology, these are used in decision making process when you are deciding that this thing should be to control that epidemiology, that epidemic in that region. You are generating specific precautions or actions, and you are implementing those actions in society and in region to control that disease. Epidemiologic methods, process of inference and interventions. These things are done. What are outcomes when we are using the information of epidemics to make the policies and we are applying the policies in a society? So what comes out? Mortality, all causes specific mortality, morbidity, disease specific indicators, general indicators, clinical use, hospitalization, medication use. So we are all doing these things. We are acting on all causes or specific causes. We are indicating the disease and applying on clinical environment, developing hospitals, and instructing the medicines and the general disease specific, as well as reducing the cost. Epidemiology operates within complex system. Our etiologic investigation continue to have a focus of simple model even if we use multivariate analysis. Etiological factors operate in complex system of epidemiology, and we need to consider the use of a system analysis approach in investigating etiology. Epidemiologists need to work at multiple levels to make the appropriate inferences. As a physician working in this health center, I am not just interested in the trends and the distribution of the disease, but I want first to know individually who are my diabetic patients and what is being done to them. So as a professional, we are focusing on our target patients, that what is the problem and how we can resolve this issue from through these information which has been obtained from epidemiological studies. Classic epidemiologic research into etiology, environmental factors, and their outcome in terms of disease and its cure. Classical epidemiologic research into etiology, other factors including healthcare, environmental factors, and other factors including healthcare, what they are uh, resulting. Okay. And healthcare outcomes, environmental and other factors, healthcare and outcomes, what is resulting on it. So epidemiology is a professional practice area. John Racy defined a profession as a socially sectioned activity whose primary objective is the well-being of others above the professional's personal gain. So epidemiology, a solid disciplinary scientific basis, requires well-grounded academic preparations, objectives within the public social domains, use well-defined paradigms of the problem investigating analysis and inference. So this is all about the epidemiological informations which can be used or which are used in public health to resolve the issues. So here we have to talk again the epidemiology we have talked in detail, and now we have to talk on public health, understanding the importance of the public health, because environment directly relates with public health. If environment is good, public health will be good. If environment is not good, public health will be not good. So we have objectives of this study is understand the definition of public health, understand the role of specific health in such jurisdiction, descriptive the key functions of the public health, provide an example of the public health impact in Lawrence Douglas County, Kansas. This is we are talking about. Replace Lawrence Douglas County with the name of your country if using a story from your country. Refer slide 14 for the additional text. So what is public health? The activities that ensure conditions in which people can be healthy. The activities, the functions in that ensures condition in which people can be healthy. These activities include community-wide efforts to identify, prevent, and combat threats to the health of the public. Institute of Medicine definition of public health. So public health, past, present, and future. Achievements of the 20th century in public health is vaccination, improved sanitation in cities and urban areas and rural areas, fewer deaths from heart disease and strokes, healthier mothers. These are the achievements of 20th century, and emerging threats of the 21st century are chronic disease, H1N1 disease, new and re-emerging infection disease, and natural disaster. List challenges specific to your community. We have to discuss. Students, you are directed. We have to discuss the issues which are existing in our society, especially where we are present at this time. What public health means to everybody, that activities which ensures the health of its citizens, vaccination, physical activities, sanitation and fresh water, and quitting such activities, making the invisible more visible. Another activity is we have to make the most non-visible things, make it visible for their public. Henderson County Health Department must be clear, which is the department which is responsible to manage, to maintain all these activities in your society. You must have to highlight and you must have to mention, like this public health. Flu season is right around the corner. Do your part to reduce the spread of flu. Wash your hands often. Cover your mouth and nose when coughing, sneezing. Get a flu shot. So such instructions should be highlighted in society. 10 essential public health services of any society. Monitor the health status of the community. This record we can obtain from hospitals, clinics, and from doctors. Investigate and diagnose health problems and hazards in society. Information and educate people regarding health issues. We have to public it on notice boards, as we have to publish booklets and many things. Mobilize partnership to solve community problems. That public-private partnerships, such like partnerships, can be used to resolve the issues of the health and public service, essential health services in society. Support policies and plans to achieve health goals. Citizens must be cooperative and supportive to achieve the goals of that policy. Enforce law and regulations to protect health and safety. Link people to needed personal health services. Ensure a skilled competent public health workforce. Ensure a skilled, competent public health workforce should be in society, which will keep eyes on the healthcare activities of that society. If someone is violating to those uh, activities which has been made by the government, so they must watch on that, they report to the competent authority regarding that, or they will make ensure that no one damage and destroy the facilities which has been provided by the state. And there should be another evaluation of the effectiveness, accessibility, and quality of health services, research and apply innovative solutions. If there is any problem, we must conduct the research to resolve that issue in society. Here we are giving an assignment to you how provide the essential services. Suppose in which community we are living, maybe we have many health issues and problems related to our health, and so we have to list specific examples how your LHD, local health department, provide the 10 essential services. If not, we must have to highlight to our society. And authorities must have to make ensure these facilities for the public. The Taylor family, a public health success story, we have benefited from the health department through the year. Sometimes we utilized it purposely. Other time we used it and did not even know it was benefiting our family's health. Barbara Taylor Lawrence, Douglas County resident, she is saying this thing. So public health. And regarding public health, we must have to support each other in our society to maintain the health standard and health. Thank you very much and take care.